Health insurance is a must in today's world, and if you're a Nevadan who is not covered, Nevada HealthLink can help you shop, compare, and purchase a plan that is affordable and right for you. In fact, today is their first day of open enrollment, and they're here to show you just how easy it can be.
Joining us now with all the details on how to enroll, Executive Director Heather Korbulik. Heather, welcome.
Thanks for having me.
Great to have you.
Happy open enrollment.
Yeah,
I know. It is truly that time of year. I have a big envelope on my desk, actually. I need to attend to that. But for people who may not have health insurance through their employer, this is especially a great opportunity.
Absolutely. We have today, November 1st is our first day, and we run through December 15th for our open enrollment period. So people in Nevada have got to get connected. We've got a lot of really good news for Nevadans. This year we're seeing consistency and stability in our plans. We have the same two carriers coming back, Health Plan of Nevada and Silver Summit, and we saw rates go down slightly this year.
Ooh.
Pretty exciting.
Wow.
Yeah.
I didn't know that
Saving
happened.
some money, I know, right?
Even better is that there are affordable options for a lot of our consumers to the point where there's even $0 plans.
No way.
Free.
How is that?
Doesn't get even better than that, right? Yeah.
How is that possible?
Because you get subsidies. So if you go on to NevadaHealthLink.com, you can determine whether or not you're eligible for these subsidies. And that's the federal government helps pay for your health insurance.
If you qualify.
If you qualify.
There you go.
That's amazing.
And 80% of our
great.
consumers do. Yeah.
Wow.
Great.
Yeah.
That's
Interesting.
awesome.
So how do people enroll, by the way?
So
Website?
what I would recommend, and insurance is confusing. You have a big packet on
For
your
sure.
desk.
It is.
And so we recommend that people go and work with in-person professionals. And at Nevada HealthLink, we certify a lot of brokers. We have almost 200 brokers that we're working with this year and navigator partners. So you can get free in-person assistance by going to NevadaHealthLink.com, put in your address, and we'll find the closest broker or navigator to you. And then you can go and work with them to find a plan that's right for your individual needs. So, you know, your prescription coverage, your doctors that you want to work with, those are the types of things that a broker or in-person assister can help you connect with.
Yeah, so important to have the right plan, though.
Absolutely.
With everything, you know, it's amazing that people push it off to the side for so long.
Oh, yeah.
And it's so important. You don't think of, you know, when something does happen, and then you're like, you know.
That's the focus of our ad campaign this year. We're really focused on making sure that people don't forego insurance because they think there's no tax penalty. Oh, we don't need to have it. Our ad campaign, you'll see soon pictures of individuals like a woman who's walking and texting and she falls into a fountain.
Oh, I've seen
That's-
Oh, good. I'm
that's-
so
well,
glad.
Oh, that's funny.
Such a funny viral video. So funny. I've seen that lots. Yes, in the mall. Yeah,
Yes,
so
I'm glad
good.
to hear that. Yeah,
Yeah.
so that's the kind of thing. Emergencies can happen, and the cost of medical care is incredibly expensive, especially if you're uninsured.
Yeah, and if you're uninsured too, it could actually, you know, take you down for years. You know, the
Bankrupt
cost.
you.
You could have to sell your house to pay the bills. You know what I mean?
Exactly,
It's crazy.
exactly. We want Nevadans to avoid that and connect to an affordable or low cost, no cost options.
What do you think the barriers are, the reasons that keep people from, you know, getting coverage? Do they think it's just too complicated, or do they think they're not going to be able to afford it?
I think it's a matter of just maybe not understanding that they can afford it. People hear about insurance through the news mostly, and you hear, oh, rates are going up. But what you don't hear is that there are subsidies that can help you drive down those costs, and that there are low cost, no cost options. So we really want to focus on those individuals who we think are primarily between your ages of 26 and 40 who have not yet connected.
And even within what you're offering, there's a range of plans, a range of prices.
Absolutely.
Right.
And depending on how much subsidy you're eligible for, there's also a range of plan benefits. So it goes from platinum, gold, silver, bronze. You don't have to have the full coverage of a gold plan unless you want or need it. And that's, again, why you need to work with an enrollment professional.
Yes.
So important, though. You got to have some sort of insurance, you know.
Absolutely.
Like it's just to save you. You just don't realize when something's going to happen.
Protect yourself,
You have to.
exactly.
Yeah,
You know?
it is. It really is. It's like you got to have the car insurance if you're
Yes.
driving, and you got to have the health insurance. Speaking of those enrollment professionals, how can people reach one of those folks?
www.NevadaHealthLink.com, and you can call our 1-800 number, which is on your display screen. 768
It's right below you.
5465. Thank you. I can never
Yeah.
remember that. Thank you.
right.
Oh, good. I'm so glad. So yeah, call our call center. We're happy to connect you.
Awesome.
So
Thanks for
wonderful.
joining us.
Yeah, my pleasure.
Yeah,
Thanks
thank
for
you.
having us.
Spreading the message.
Yeah.
Open enrollment begins today for Silver State Insurance Exchange through Nevada HealthLink. To register, it's easy, guys. Just visit their website or call the number on your screen. You can also find them on Facebook and Twitter. Silver State Health Insurance Exchange, a proud sponsor of The Morning Blend.